Welcome, everyone, to our session on the Capacity Strengthening Platform. We're very happy to have you with us today. I will turn the mic over first off to Keith to help us open the session.
Thank you very much, Andrew. Well, welcome everybody to this important session on capacity building. And we have a stellar group of speakers here. I won't spoil the ask that we're going to do, but a lot of work has gone on for quite a few years with CUGH, with AfriHealth, and we're honored that Dr. Kuguli Malawadi is here and others. So know that the site that's going to be announced that Dr. Dykins has done a tremendous amount of work over the years to produce gets to the heart of a fundamental challenge that all of you are aware of, and that is the human resources deficits in low resource countries. So what we aspire to in this session is that you help us. Dr. Dykins and Dr. Kuguli Malawadi will talk about the platform, but it's really important that you use it, you share it to deal with this challenge. And we appreciate your guidance and your input into terms of how we can use it widely. And we appreciate your help in actually spreading it out worldwide. So there's a lot of parts to it that our esteemed speakers will talk about today. And so thank you for joining us. And I'll turn it back to Dr. Dykins. And just before I go, just a big thanks to Jenna Smith and the team here, Dalal and Sarika, for all your help in putting this together. So Andrew, back to you. Thank you.
Wonderful. Thank you so much, Keith. And I would like to express my sincere gratitude to all who have supported this initiative along the way. And I'll actually present a slide on that. Let me go ahead and share the screen. And we'll get to presenting our panel so that you can meet who is with us today. All right, so arranging my screen here. And so, yes, today we're focusing on the Capacity Strengthening Platform, which is a global matchmaking web platform facilitating equitable institutional partnerships and mentorship to strengthen health workforce globally. This is the web address, and you'll see QR codes throughout the presentation. So I'd like to just go ahead and encourage everyone to pull out your mobile device and use it alongside while you're watching this on your computer, because there's going to be some interactive components through this session. And so if you just go ahead and log in through your mobile device, then you'll be able to join us and working through some things while we're moving forward. So here's today's panelists in the order that they'll be presenting for this presentation today. So Dr. Kuguli Malawadi, would you like to introduce yourself?
Thank you very much, Andrew. Elsie Kuguli Malawadi. I'm the president of the African Forum for Research and Education in Health, AfriHealth for short. I'm based in Kampala, Uganda. I'm an honorary professor of radiology at Makerere University. I also work at a non-government organization. It also has a long name, African Center for Global Health and Social Transformation. And I've really enjoyed being part of this work. And I would like to thank CUGH for the opportunity to work with Andrew and others on this platform. Thank you. Over to you, Andrew.
Thank you so much. I'll be taking over the presentation after Elsie's finished up her section. And my name is Andrew. I'm at the University of Illinois, Chicago. I'm an associate professor of family and community medicine. And at the Center for Global Health, I conduct cervical cancer prevention and control research, primarily in Senegal. And have been very involved, honored to be involved with the Consortium of Universities for Global Health for some time. Dr. Bui, would you like to introduce yourself, please?
Hi everyone, Thuy Bui. I'm on faculty at the University of Pittsburgh. I'm an internist and I direct a global health training program, but have been partnering with College of Medicine and Kamuzu Central Hospital in Malawi for 25 years now. Thank you for having me.
Thank you so much. I would like to just recognize Dr. Meyer Desai, who was instrumental in helping us prepare today's session. Unfortunately, he has a conflict and was not able to join us today. But I wanted to express my gratitude to him for all of his support. I'd like to introduce Asmer Khan. Would you like to introduce yourself, please?
Hi, everyone. My name is Asmer. I'm also at the University of Illinois at Chicago. And I am a human rights and medical rights consultant for the government of Pakistan and part of the ambassadors program. Very excited to be here.
Great, Asmer. Thank you so much for all of your support and work with the team over the past many months. I'd like to welcome Josephine Naboisi. Would you like to introduce yourself, please?
Hello, everyone. I'm Josephine Nabawes from Uganda. I'm a nurse currently doing my own internship at St. Francis Hospital, Zambia. I'm so glad to meet everyone. Thank you for tuning in. Thank you, CUGH, for this opportunity. And I can't wait to share ideas with everyone. Thank you.
Thank you so much. You're very welcome, and it's wonderful to have you with us today. Mariam Mohammed Aid, would you please introduce yourself?
Yeah, hi, my name is Miriam. I'm one of the undergrads here also at UIC, University of Illinois, Chicago. I'm one of the new members of the ambassadors program. Yeah, I'm really excited to be a part of the team and kind of help grow this in the future.
Wonderful, thank you so much. Fatou Demajum, would you please introduce yourself? And Fatou,
of course, my name is Fatou. I'm also an undergraduate student at University of Illinois at Chicago, and I'm also a part of.
All right.
Huh? Sorry, cut out for me a bit.
Thank you so much, Fatou. Thank you all so much for being with us for this discussion today. And so let's dig in. This is a list of the team members that some of the core team members over the years that have been involved in this. There are many, many others that have contributed to this initiative that we're thrilled to share with you today. I also want to recognize the funding that this initiative has received through a grant through Consortium of Universities for Global Health, the Tom Hall Education Committee's small global health education grant. For those of you who knew Tom Hall, an absolute incredible person who has left an enormous legacy. And then the NIH Fogarty International Center has supported this work, and we're eternally grateful for their support in taking this to its current form. Here we see the past director of the Fogarty International Center, Roger Glass, who is registering for the site, so encouraging everybody else to use the platform. All right, so I'll turn the mic over now to Elsie, who will discuss with us some of the background about the global healthcare workforce capacity.
Thank you, Andrew. I'll talk about global healthcare work capacity. We all know that healthcare workforce is an essential part of the healthcare system. Without the human resource, there's no way we can care for our patients. And it is important that we have equitable access to healthcare services at all levels. That's at the primary, secondary, and tertiary levels. And this is important for us to be able to meet the global requirements for universal health coverage and also for meeting the Sustainable Development Goals. Next. So a lot of work has gone into finding out what the status is like for the global health workforce. And it has been reported that there will be a global shortage of 18 million health workers by 2030. And this report has been widely distributed and read. And it shows that there's a disparity in growth and development of the healthcare workforce globally. But we also know that the two regions that are most affected are the WHO African and Eastern Mediterranean regions. And work has shown that there's been no improvement between 2013 and 2020 on the health workforce disparities in both these regions. And it has been noted that this will be stagnant into 2030. Going on to really emphasize the WHO African region, where the highest shortage is and where the biggest gap is, it has been reported that 36 countries of 47 of the countries that have a critical shortage of nurses, doctors and midwives is in the WHO African region. And the shortage has been estimated to reach 6.1 million by 2030, with an estimated average of 1.55 per 1,000 population. And this is far much less than what is required to reach the Sustainable Development Goals. The requirement is 4.5 health workers per 1,000. And even within the African region, there's still uneven distribution with a big range, for example, 9.15 per 1,000 in Seychelles, while the lowest in Niger is 0.25 health workers per 1,000 people. So you can see that these disparities even within the region are really large. And the number of those 36 countries are actually at the lower level between 0.25 and 1.55. So the shortage cannot even, the numbers speak about it all. We do not even have to emphasize it, it's obvious. Next slide. So many solutions, of course, have been suggested, and some of them include partnerships, training programs, and mentorship. And this is what the CUGH platform is really based on, that individuals and institutions can connect and share training resources in order to strengthen the research capacity in low resource settings like in sub-Saharan Africa. And these are things that we can try to at least mitigate some of the challenges that are on ground, like the lack of qualified trainers and mentors. And also, it is difficult to connect existing expertise and established training programs to areas and individuals with identified training capacity gaps. Although the training gaps may be identified and they are existing, sometimes it's difficult to connect the expertise with where the needs are. Next. So this is a proverb that is well known in global health. And with this kind of platform, we hope that we can work together to meet those the needs of whoever works with us. So this African proverb says that if you want to go fast, you go alone. But if you want to go far, you go together. So this is, we have this at the back of our minds as we put this platform up for use between the different regions so that we can work together to find solutions for those health workforce gaps that have been identified. Next. So looking at these global health partnerships for capacity strengthening, we can see that it's important, and partnerships have worked, and we recognize that many have worked really well. So this is work in progress, adding on to work that has already been done between partners. But even then, we know that the gaps are still there. So there's still more work to be done. And that's why we've come up with this capacity strengthening platform. And I would really like to thank Andrew for all the work he's put into this, and of course CUGH for allowing us to be able to do this work. So this platform, the CUGH Capacity Strengthening Platform, is based on global health partnership principles, which are upheld by CUGH and AfriHealth as well, that where it's possible that we partner locally, because with the minimal geographical distance between partnering institutions, this minimizes challenges like logistical and travel challenges. Where it is possible, that is encouraged. But if this is not possible, then we encourage even partnerships across long distances. Equitable matchmaking, this is important, that all institutions should have equal access to potential partners and training opportunities in order to ensure equitable matchmaking. So that is also important for the CUGH Capacity Strengthening Platform. Transparent training capacity priorities are very important, that for us to ensure that partnership priorities are driven by the institutions with the existing training capacity needs and gaps, and that these matches, when they are active, they are based on transparency, and that the needs that are identified are the ones that are addressed, not those ones that may come in from different areas. Having a strong contextual understanding is critical, because without contextual understanding, there would be no way to partner. So institutions and training capacity objective contexts should be readily understood in order to ensure that developing partnerships as productive as possible. Next. Local priorities to drive external focus. So if there are grant mechanisms, external funders, external entities should support the expressed priorities and the existing training capacity needs. And as I said earlier, this avoids coercion. Sometimes it's intended, sometimes it's unintended, but making sure that training programs are focused on the local priorities is really important. Responsibly distribute partnership benefits. Yeah, out of these partnerships come secondary benefits, such as indirect funding, faculty development, and trainee education opportunities, sometimes publications. So we would like to emphasize that out of these partnerships, we would want to ensure that there's a good, responsible distribution of the benefits. And long-term partnerships, we hope that these partnerships, of course, they always start small, but we hope that they build into long-term partnerships, and this should be encouraged in order to build mutual understanding, institutional memory, and effective synergistic relationships. Equity, reciprocity, bidirectionality, social justice, and humility are all very, very important virtues for global health partnership principles. And these are the ones that we based the CUGH Capacity Platform on. And we hope that all partnerships that arise out of this platform will be able to cover these power differentials and make sure that if they are constrained, they are openly addressed, and at the end, the mutual benefit is for all those that use the platform. So over to you, Andrew. Thank you.
Thank you so much, Elsie. Very much appreciated. All right, so let's then just jump into getting an understanding of what is the capacity strengthening platform and what does it do. So in the following slides, I'm actually going to just present to you screenshots of the platform and illustrate its functionality and a bit about the process. After I'm done with that section, then we'll have a bit of time to have some quote unquote workshops on the three major functionalities of the platform. And so we'll take you through those. And so we'll give you a chance in a bit to get registered for the site and work through some of those things if you're so inclined. All right, so let's just jump in. I want to also mention, though, first that there will be the opportunity to win free registration for the CUGH annual conference in Los Angeles in March of 2024. There will be 3 of these registrations awarded, and the winners will be announced in January. So this is just an opportunity to help us encourage you and others to sign up and engage with the platform. In order to be eligible for the registration, then you will need to accomplish the 3 tasks that are listed here. You'll need to sign up. You'll need to create a post, either a partnership, mentorship, or training program post. And then you'll actually need to create a match, either in the partnership or the mentorship arena. And so I will discuss with you how to go about doing this. And from those that complete these 3 steps, then we will select 3 individuals for this registration for the March 2024 CUGH conference, and we'll very much look forward to seeing you there. All right, so the steps of engagement for the capacity strengthening platform: register, create postings across 3 major areas, and these are seeking partnerships for training needs and expertise. This is where there's not a training already established. There is expertise on the part of one institution or a gap identified by an institution or an individual, and you're seeking a partner to complement either your expertise or your gap. So you can register yourself or your institution in that way. If you have an established training that's already existing and is open for enrollment, then you would post an established training. If you are seeking a mentoring relationship as a mentee or a mentor, then there's another opportunity for posting in that realm as well. So 3 major types of postings, and we'll take you through those. In addition, you can search on the platform for others who have created postings in all of these areas. So you can help to identify potential matches for yourself. You can find new partners in this way. You can find training programs that you might want to enroll to, and you can find potential mentors or mentees. Then you can connect, and there's functionality on the site for you to be able to connect with each other, message through the site so that you do not have to reveal your private information until the point where you feel comfortable and have agreed that you would like to move forward together, then you're welcome to share your personal contact information with that individual directly, and then further develop your partnership. So it should be noted in this section here that this platform is really a matchmaking opportunity. So you can think of it, we like to say match.com for global health. It's a little bit of a funny way of thinking about it, but really it's really focused on the matchmaking to identify complementary positioning where people need to connect with someone to create that partnership. So we're hoping to build an online community to discuss these opportunities, to share these opportunities, and to find others in really unique ways that up until now have not been, we've not been able to do. And then step 5 is to strengthen capacity. And this is where we're going to work together, and we'll register our matches on the site. And that helps us to share our experience with others as well. And so there's opportunities for sharing materials such as reports and publications, links to publications, and also registering the number of individuals that you have trained on an annual basis. And that helps us to understand the impact of your partnership so that you can share that with others, which in turn helps us to understand the impact of this platform. So we're very hopeful for that. All right, so let's start with step 1, registration. So if everyone can just go ahead and pull out your phone right now and go ahead and scan. I'm going to walk you through this very quickly, and this is really your chance to register. Of course, you can do it at any time later in the session if you'd like. But we would like to encourage you to go ahead and quickly work through this because there will be opportunities for engaging later in this presentation. So you can just click this sign up button right here. And then you can move forward, clicking one of the options of seeking either a partnership or being a expert or seeking a partnership to address a training gap. And then you'll enter some information, your email, password, first name, last name, select a username, which will be your @ symbol on the site, register your institution and the country of your institution. And then there's a few more questions, I think, as you scroll down that page. If you want to just go ahead and take a moment to do that. While you're working on that, I'll go ahead and move forward. That will allow you to, you'll get an email where you'll confirm your email address, and then you'll be registered on the site. And then when you reconnect with the site, it'll take you to a dashboard. And that's what I'm going to walk through with you right now. Your dashboard is where you're able to connect and identify all the tools at your disposal. It's your home base where others can also connect with you. And so you can dress that up a little bit in the future by adding a profile picture and a background. And you can edit your profile further to add additional information beyond the information that you have added just through the registration process. So we would encourage you to go back and do that. In doing that, you can actually add a CV and other materials that might be useful for others to learn a little bit more about you. All right, so you can do that by clicking the Edit Profile button, and then you can provide a little bit more information as is seen here. So this is an example of another registration, and Josephine has joined us today. And so she has been very active on the site, and we're going to get a chance to hear from her a little bit later in the presentation about her experiences in working through this platform. Here are some other examples of registrants on the site from various places. So we are very much looking forward to welcoming you. And so now let's get into creating postings. So I'm going to walk with you very quickly here through the 3 types of postings that you're able to create on the platform. And then, as I mentioned, we'll have some time later in the webinar to dig into those a little bit with some Q&A on each of these sessions. each of these pieces. All right, so you can do this here by going to your dashboard, which is on the left-hand side of your screen, and then clicking on Create Posting. At which point you'll have the opportunity to create a posting title. Now, this is a very important piece of your post, and it should be descriptive in nature that helps people to understand what it is that you're looking for. So if you take a look through the existing posts on our site, and I'll show you how to do that in just a little bit, you'll get some ideas on how to create good titles that are descriptive and help people to engage with you just by looking at your title alone. And then you'll have the opportunity to choose a preferred area and preferred type of post. And that essentially is in the general posting or the implementation science post. So I want to draw a distinction here. We're very fortunate to have a focus of this platform on implementation science. All posts, including the implementation science posts, are included in the general posting area. But if you are seeking or wanting to specifically place something into the implementation science area, then you can click in this area here. Implementation science is extraordinarily important in developing capacity and helps us to understand how to further capacity at the institutional level, at the community level, through adapting and implementing evidence-based solutions into place. So these are very, very closely tied, and we'd like to encourage you to build out areas in the general area as well as implementation science areas as well. In each of these areas, you can select a preferred type: training program, mentoring, or partnership. Now, I want to distinguish again the difference between training program and partnership. Training programs are existing. These are enrollment-based training programs that are currently in existence. So if you have a training program that's ready for enrollment and you're seeking individuals to sign up for that, then you would seek a training program. If you are exploring the opportunities for partnering to develop a capacity building exercise or opportunity, developing a training that is not currently in existence, then you would state that you are seeking a partnership. And then, of course, mentoring is self-explanatory, both as a mentor and a mentee. And so when you have selected one of these, then you'll have the opportunity to say whether you're providing the expertise or seeking the training. And so that categorizes your post on the site so that others can find you very easily. All right. In addition to that, you'll have the opportunity to provide additional information regarding your post. So if you're in the implementation science area, then you can describe what training competencies, for example, that you're focused on, or what domains that you're focused on in the audience section that is applicable as well to the general posting section: public health, medical education, the clinical medicine domain, medical officers, physician assistants, nursing, nurse practitioner. And then you can scroll on down to see that this applies to other areas such as law and environmental sciences, et cetera, because in effect, all areas have some relationship to health. And so we're wanting to build out capacity across a very broad range of technical domains. After you have selected an audience, then you have the opportunity to select subspecialties of that audience type if you so choose. You do not have to do this, however, but you are welcome to further characterize that if you'd like. Depending on what your selection was in the top area, it will provide you additional options in the specialty area. You are also welcome to state whether this is for pre-service or in-service training and what level of the training of the audience it is. You can also provide additional context depending on whether or not you are registering or posting a training program or a partnership request or a mentorship request. The context questions will differ. You can take a look at those and specify what you would like to identify as being pertinent to your request, to your post. And that provides those who are browsing to just understand a little bit more about what you're seeking. If it is focused on a technical area, a clinical or technical focus, then you can select that it is focused on that, and you can actually identify a specific disease or diagnosis or public health issue if you would like. You'll have the opportunity to select at a high level a category of clinical or technical discipline, and then you will have the opportunity to specify through open word entry what that specific area is. This is not required if this does not apply, but you're welcome to specify this if it does apply. All right, now this is very important. Everyone have the opportunity to provide some additional information through text, where you can describe your opportunity. And the titles for these will change slightly depending on whether or not you're seeking a partnership or a mentorship opportunity, or describing a existing training program. And then some additional information, and these will populate on your posting for others to learn a little bit more. You can also provide a relevant URL for your website if you would like, and then you can submit this. All right, now you can search on the site. So let's go and see how to go about doing that. So all the postings that are in existence, so then you can go to the search area and click onto the left, and then you have the opportunity to search the general postings, or if you want to search just specifically implementation science postings, then you can click here as well. And it'll take you to the search page where you have the opportunity to put into the search box keywords that will automatically filter the searches that are in place, or you can narrow down your search results through additional filters by country or by posting area, focus, etc. So there's many options there just to really help you identify those potential matches more readily. So if you were to specify, for example, in the open word search category, cervical cancer, then it would automatically pull up various options for you. Excuse me one second. Okay. And then as well, you can filter in this section here that allows you to, again, seek something in implementation science, a training program, and then you would identify the training programs that are there in this area. And we are very interested in building this area out as well. So if you have an enrollment-based implementation science training program, then please go ahead and register that, help us build that out, as well as other areas that interest you. All right, so what does a post look like? So at the top of the post, it will identify the type of post that it is. This is a training program post, and then the title for that, as well as all of the additional information that's listed here. These are the context pieces over here on this bar, and then your open word descriptions are listed here, the URL, and then other information. Your institution is listed here, and then that's followed by the country of the institution. The individual who posted this, as well as when it was published and updated, and when it will expire. So every post will expire after 1 year of it being published or updated. And so you'll, as an author of a post, you will get a update through your email, encouraging you to update that when you're getting close to the 1 year deadline. If you do not update it within 1 year, it gets automatically archived. So that gives all of those who are engaging with the platform confidence that all of the posts that are on the platform are relevant and relatively up to date, at least within the last year, which is really important. If your post does get archived and that was not your intention, then you can go back, and I'll show you in a bit, update it, and it will then be republished. It will not be lost. You can connect with the author of a post by connecting here through this button, or you can save this to your personal list for you to refer to later. There's also some social media links over to the right, and we'll illustrate in a bit how that's used for you to give you the opportunity to share that with others, help bring them into the site. If you know, for example, someone who's very interested in a particular opportunity who may not be already engaged on the site, then you can share these things with them. All right, so here's another example of a post for a partnership. And this is someone who's providing a training expertise. And they're seeking partners for a neonatal nurses essential training and skills program. Naveed posted this in April, and it was updated. And you can read all about it here, and there's a relevant website for this. So this is a very nice illustration of a post, and others then can connect with Naveed through this to see about how they might be able to engage and explore a potential partnership. So when you connect with someone, you would just click on the connect button, and then it illustrates that the request was sent. Naveed will need to accept the connection request, and then you will be able to message each other on the platform. And I'll show you how to do that as well. On your platform home, then you will find here a timeline as well, where you can write something to each other and post something back and forth. Excuse me. Okay, I'm back with you. My sincere apologies. My throat was getting a little bit dry. Okay, so let's move forward. All right, so you can find your saved postings again on the left here, where you can find the saved postings section, and it'll take you to the postings that you have in place. And those that you have saved will show up here. And that's just an opportunity to remind you of the things that you are looking into. All right, so how do you connect? So again, you connect through the connect button, and you connect as well through the social media buttons, as I've illustrated already. This can be found in your connections section that's listed here. And you can discuss opportunities for connecting directly through your own timeline, where you can send messages, and you can specify whether those are public, or if you want to communicate directly with an individual, then you would put just you. And here's an example of a message that is going out. And this is through your timeline. In addition, so this is that was a public post. This is a private post to an individual. All right, so then you can strengthen capacity together, finding your saved postings again, And your messages section is where you can directly message individuals off of your timeline, separate from your timeline. It should be noted that your timeline is only through the platform itself, whereas messages, if you send messages directly to individuals and once you're connected with them, then you can click the 3 dots next to their name and select send message. Then you have a messages section here. That sends them a message through the platform as well as through email. So you'll be able to connect with them through email in that way. It does not reveal their email address or your email address, but it notifies them of a message through their email. All right. So once you have a match, then you can list that matching here on the left-hand column as well. Now, this is a new functionality, so we don't have any new matches quite yet. If you're exploring that, there are some examples, tests up there just to show you kind of what that looks like. And then you can play around with that functionality a little bit. And so if you are creating a match, then you would select, again, the type of match that you have listed, as well as the countries that are involved. So you can select multiple countries and list multiple institutions as well. And then the year that that match was initiated. And then you can provide some description about what that match is like and what's happening. And you'll have the opportunity to update annually the activities of your partnership. So it will archive each year. That will be available through the site for people to peruse and see about what your partnership has been up to each year. You can provide citations and documents for others to read about the impact that you are achieving through your partnership. If you have trained individuals, then you can list here what types of individuals you have trained and the number of individuals that have been trained in that given year. And then a contact person for that particular match. Contact us if you have questions through the platform, through this link here. And there's a web form for you to connect with us, to ask questions and get additional information. Okay, so now I've walked through the major components of the platform itself. And now we would like to encourage you, because we're moving into kind of the workshop section of our presentation. And I'm seeing that looking here on our background, and I'm seeing that we are having some people signing up, so we'll greatly appreciate it. I'm just going to give you a moment to work through signing up for the platform, and then we'll move into a workshop session on each of the 3 areas of posting types. We'll give you the opportunity to kind of play around with those a little bit. And so I'm just going to pause for just a second and give you an opportunity to register for the site. And in the meantime, if you have questions that you would like to put into the Q&A or anything into the chat, then you can go ahead and put that, and we're monitoring that, and we'll get to a Q&A session here in just a little bit as well. All right. All right, great. So I'm monitoring here. I'm seeing some people signing up, saying thank you so much for registering. And please continue to register. There's some more QR codes on some of the others, giving you the opportunity to play around with a little bit of the functionality, connect with each other during this webinar session. So let's move forward, and we're going to talk first about seeking a partnership. So creating a post that's directed at seeking a partnership. And I'm just going to give you a couple of examples, and then I'm going to actually connect directly to the platform itself and walk through a couple things with you. There we go. All right. So here's an example of someone who's seeking a partnership and providing training expertise. This is geriatrics program development in low and middle income countries, the University of California, San Francisco. Barbara has posted this, and you can see some of the key information, contextual pieces over here, a very nice post that gives you a good idea on how you might be able to engage with this opportunity, when it was published, when it will expire, and then connection to that individual. Here's another example of someone who's seeking training through a partnership. And this is a very specific opportunity for a partner. So we really like to see this as well. There's opportunities, I should state, if you have a very broad need of just training nurses, for example, then completing the form is really quite simple. And you can just register that need at the medical school or the nursing school, whichever type of audience you're wanting to train, and describe the training opportunity need that you have, and create a title that illustrates that general training capacity need. And the posting process is pretty straightforward. If you have a very specific need as well, then you can do that as well and categorize those things and contextualize these things. And so this is an example of one that's a bit more specific. All right, so let's do a live workshop. I'm going to dial off of the presentation for a second and pull up the site itself. Okay, and I'm not sure, I'm going to stop share and then reshare just to make sure that you can in fact see that screen. All right, there we go. So let's walk through just very quickly about how to create a posting for a partnership program. And you can do that through the dashboard, and you can go to create posting. And then you can create a posting title. And again, this should be a descriptive posting title to succinctly describe your request. This is very important, that your posting title is very descriptive. And then you would just select what area that you're wanting to post in, and this would be seeking a partnership. This is a future training as opposed to an existing enrollment-based training program. And then you're seeking training, for example, or providing expertise. Located in Ecuador, and this is your institution. All right, this is a technical training. So you could request training for research as well, research training or technical training. If you select technical training, then it doesn't necessarily need to apply to a specific disease, but you can select that if you want, perhaps neoplasms, cervical cancer. Okay. And you're wanting to train nurses, and you could just leave it like that if you want, or you could select professional nurses, adult. And in whatever area. You can see here, there's many different areas from which to choose from. We'll select hematology, oncology for the purposes of this. You're wanting to train nurses in the field, in service. And again, if there's not a star next to it, you actually don't have to select those things. And then you can contextualize these things. The number of months, anticipated duration of the training program. You'd like for this to be a 1 to 2 week training program. The approximate number of trainees, you'd like to train somewhere between 11 and 30. These are advanced or intermediate level that you'd like this training to occur at. If you have an idea of the language that you'd like the training to be in, you could also select that as well. All right, and then you can provide a little bit of information here, and then the URL, and then you can submit. Scripting piece up here. All right, so that gets submitted. And then you can see here immediately that this posting goes live. All right, so another piece that I want to show you very quickly here. So I'd encourage you all to kind of play around with that a little bit. But another piece that I want to show you here is that then you can edit this. You can edit, republish, or delete it. And you do that by logging in and being on the post itself. You can find your post through your dashboard. So you go to your dashboard, profile, and then you have my postings listed right here. And here we can see this posting that we've just entered. So you click on that, takes you back to the posting, and then you can edit it. So you can edit the posting, you can change some things if you want. Let's leave all that the same. And you want to just change a little bit of information here. You want to update something, you resubmit, and now it's been updated. Okay. And then if you decide that you want to delete this, and we highly encourage you to play around with these, create stuff, make some mistakes, no problem. Then all you have to do is just delete. No problem at all. You can delete your post, and just like that, that's it. There we go. So well, in theory, it gets deleted. There we go. Okay. So that is how you go about doing, again, the posting for the training program and searching for training programs. You would just go to this area here and just seeking training program, and then those automatically populate here, what you're looking for, and you can specify a particular area if you want, and then you can find posting that fits your need. Here's a training program. Oh, sorry, I did training program. Posting type, partnership. We're doing partnerships right now. Mental health. None in that area, but you can see the areas where they do exist. Okay, so there you go. Now let's go back to the presentation, and we're going to do the Q&A section here. So we're going to visit the chat, visit the Q&A, and see if anybody has any questions. There are no questions currently open.
Andrew, there's a question in the chat about CUGH membership. Do you have to be membership to establish an account on the dashboard?
No, you do not. This is open. This is open to everybody. You do not have to be a CUGH member. Of course, we encourage you to be a CUGH member, either as an institution or as an individual. But this platform is for everyone. Open platform. Thank you so much for that question. That's a very important question. So there is no fee for using this platform. You can sign up. Everything is free. The platform is completely open. Okay, great. What other questions do we have today? Thank you all so much for engaging with the chat. Looks like there's an active discussion here going on. People are voicing in from various places. Very much welcome you to the conversation. What other questions do you have for us? All right. Here's a question from Karen. What's the best way to send a gentle reminder to someone to respond if you haven't heard from them? Great question. So the best way to do that, I think, would be to send them a message, and that would be through your connections right here or your messages. All right, so let's cover this really quickly. That's a great question. On the left-hand bar, you can find your connections. These are people with whom you have connected. So you have connected with them through their post here, and they have accepted your connection. You can find those individuals through here, which is on your profile page, your connections. So you can go and identify that person on your connections and send them a message. That takes you to your messages section. And then you can send them a message here. And that will send them a message through the site itself, as well as to their email. You can see the messages that you're receiving. So that's a nice way to prompt them, because that prompts them through their email as well as through the site as well. You'll see notifications here. If someone has sent you a connection request, then you'll receive that on the site, and you can just go to that request and accept it. Okay. And once you have accepted that request, once you're connected, then you can directly message that individual. So you can view your old notifications here, the ones that are unread, the ones that are read. Here's Miriam, who I just connected with. And I can go to Miriam's page and I can send them a message from here. All right. You can also just create a new message in your messages section. Create a new message. And if I want to send a message to Osmer, then I can just identify that and send Osmer a message. All right. And so that's how you can message on the site. Again, messages will also ping individuals through their email. And you can see as well notifications about messages that you have gotten. And so I'm not sure if Jabril and James are with us today. I hope that you are. If you are, send me a message. If others are connected with me, send me a message. Connect with me if you'd like in real time here, and we can play with this functionality. Osmer is available. Josephine is available. And others. So we can play around with the functionality a little bit here. All right. Thank you, Karen, so much for that question. We were able to walk through a few different things as well in responding to that question. All right, please type in additional questions if you have them. Let me just check the chat again real quick. All right, Karen is messaging me. All right, very good. Excellent. Getting more messages. Greetings, greetings. Awesome. Thank you all. All right, let's go over here and see if anybody's playing with the posts. And then we'll move on. I don't see any new posts here. If anybody wants to try a post or two while you're kind of hanging out, then we can try some new things here. So I'm going to turn the mic over now to Thuy and Josephine, who are going to tell us a little bit about mentorship posts. And so let me put this in presentation mode here for a second, and then we'll go back and have another discussion in this area. So
Yes, Josephine will present this section.
okay, great.
Hi everyone. Can everyone hear me?
Okay, Josephine, we're having a little bit trouble hearing you.
Hi everyone, can everyone hear me?
There we go. All right, take it away.
All right. Talking about the mentorship. We all know what mentorship is. Being a mentor and being a mentee, those are self-explanatory, I think. So mentorship is simply guidance provided by a mentor or someone more experienced in a field that you have interest in. So this platform, the CUGH platform, enables one either get into a mentorship relationship with someone else, or like this platform enables one either become a mentor to someone or becoming a mentee to the other party. So we all know getting someone to be mentor to you is a little hard. Being a mentee is all most of us can be. It's easy for me to wake up and be like, ask for a mentorship relationship, maybe with Miss Elsie, and be like, I want to be your mentee, but then getting someone to accept to be your mentor can be a little bit hard. We all, I think, have attended conferences, we have had lectures look up to, how we look up to in fields we want to thrive in. Then you look at someone and you approach them physically and you're like, I want you to be my mentor, or can I be your mentee? And like, it's a stranger just meeting someone, and yes, you've liked them or you've heard from them and you want to be their mentee. It can take quite a while for this person or it takes some time for you to prove yourself to be a mentee. This is one of the relationships that is not easy to build, mentorship relationship. But this platform gives us an opportunity to see people. Like, you can go to someone's profile, as Andrew has not through. You're able to see someone is in the institutions that we all look up to, or in institutions that got
Josephine,
yes,
I'm sorry to interrupt you. Your audio is kind of coming in and out. I'm not sure if there's if you're able to speak more directly into a microphone. But
all right.
you're
Can
kind
you
of,
hear me now?
we hear you very well. Yes, at times. So
Okay,
yeah, that
all
sounds
right.
good.
Let
So
me,
if you, whatever you're
okay.
doing there. Thank you, Josephine. Continue on.
Sorry about that, please. Sorry about that. So about this mentorship relationship can be a bit difficult to build at times, but this platform gives us an opportunity to build these relationships with people we look up to. So I'm asking everyone who has not yet signed up into this website or who has not yet signed up into this opportunity to take this chance. Message these people. You know, there is a saying that says persistence breaks resistance. You send them politely. Be polite. Put your goals out there to this person. Ask for this person to be your mentor in a polite way. If they don't reply, it's okay. Try again. You keep trying because persistence breaks resistance, and with time, you'll get what you want. As for the mentors, if someone is asking, a young person is asking to be a mentee or is asking for mentorship, please accept, please look into it, please read through their manifestos to be mentees and let this thrive. Because when I win, when you win, when I'll always look up to you and always remember that, oh, it's through the CUGH platform that we met and I've achieved this because of you. So in this global health program, we all have common goals with an aim for making health better for everyone. So if someone wants to work out something, I'm of the opinion that you give them a chance. Also, to my fellow young people who are still at university, college, please be vigilant. Don't give up. Keep posting. Keep putting your training needs out there. Keep looking for these mentorship relationships with these people. And trust me, you will win. Thank you.
Thank you, Josephine. This is, by the way, Josephine's post that you can find through the platform. And we have another example of a mentoring post, which is located here. These are very descriptive. And as Josephine was mentioning, we really encourage everyone to post yourself as mentees, and we would like to have mentors as well create posts to try and join with others that you may not otherwise have the opportunity to meet. All right, very good. So let's move into a Q&A session on the platform. For the mentorship. And here's a question here. Okay, so another question about fee. So registering for, just to be clear, registering for the platform is completely free. There is no fee for the platform. Let's see if there's anything else going on over in the chat section. Okay. Let me go back to our live site. And just illustrate here, again, creating a posting for a mentorship simply is the same process, creating a posting and seeking mentoring. And you can select seeking mentor or seeking mentee. Mentor, seeking mentee. All right. Should also be noted in this section, it's really important to note that in your dashboard profile, you have the opportunity to upload some additional documents. Okay. So you can go here and upload files. You can upload a CV or additional documents that describe your work, describe your experience, describe more about yourself. And during the posting process in the mentoring section, then you have the opportunity to select those documents from here. So you can select your CV, you upload it through your Documents tab, and then you would select it here. I don't have one uploaded right now, else I would be able to select there. And if you want to upload a personal statement, again, you can upload that to your profile and then select it here. If you don't have those, you can still move forward with your post, and then you can go back, enter those later, and pull them in through an edit. Just an opportunity to provide more detail and specificity in the mentoring section. All right. Very good. Saskia is connecting. Absolutely. Thank you so much for reaching out. So I can find Saskia now in my connections. I can send them a message. All right. Very good. And maybe Saskia will send me a message back in a bit. All right, and Josephine has replied. Thank you so much, Josephine. All right. All right, so let's move forward. Let's see if there's any more questions. No open questions in the Q&A. Anything in the chat that we need to know about for the moment? All right. Yeah, for those of you who are attempting to register on the site, if you're having some issues, let us know. We can help you work through some things. Also, if you'd like to take a moment to try your hand at a posting, don't be afraid to create a posting that that you can just delete later. It's okay. We encourage that. All right, so let's go over and talk a little bit about training programs. So these are existing enrollment-based training programs. Let me put this. Just want to show a couple to you. Here is a request for enrollees in an existing training program on human trafficking through Baylor College of Medicine. The website is listed here, and it gives you a little bit of information about this short duration training. So you can see an example here. Here is a training program in dissemination of implementation researching cancer, TITRE, through the NIH, National Cancer Institute. Describes the program, gives you the website where you can go find out more, connect with them about this. for this moderately lengthy in duration training. This is an open access training at your own pace. And just some examples of the types of trainings that are possible. And we would encourage you to register your own training programs. If you don't have your own training program and you know of others that do, then please reach out to them and have them register that through here. And again, same process. All of these start with create new posting, which is right here. Descriptive title, preferred area, and existing enrollment-based training program is where we're working now. This program is being offered in Albania. And you can see the several contextual questions that you can respond to. This is a 2 to 4 week training. We have up to 100 seats available. Is there a cost structure for this training? There's no cost, or there's a fee. So that can be registered here. What is the application deadline? This one's coming up very quickly. This is an unspecified or contributes to a fellowship program, what have you. What is the actual cost? $1. All right. So then you can contextualize those things, provide a little bit more detail, URL, and submit. And then your posting is live automatically. And here's this training program. All right. So that's how that works. All right. Very good. Any questions about this? Check the Q&A real quick and the chat. All right, a little bit of a conversation going on here. All right, so let's move forward then in the presentation. Thank you all for engaging with us in the demonstration section. Please continue to do so. And we'll have some time at the end as well. If others want to stick around, I'm happy to hang out and answer questions, help people with creating some posts and that sort of thing. But let's go ahead and move into dissemination strategies. Okay. All right, so basically, we are very happy to engage you in the platform itself and work with you, help you find connections. We would also like to humbly request that you help us disseminate this platform out to your networks. So we have prepared a few things for you today to introduce to you so that you can help others learn about this and share this platform with as wide an audience as possible. So I'm going to turn the mic over to Tweet.
Thank you, Andrew. Next click. So we can leverage, we know that we could leverage social media for networking and professional development. And it's well known that social media have the potential to reach broader audiences for knowledge dissemination and sharing academic work. So social media platforms shifts the mode of dissemination activities from a pull model to a push model. So you can think of the pull model is like searching for relevant information, posting or connection on the platform. But once you found a posting of interest, you can push the posting directly to member of your network through WhatsApp, email, LinkedIn, Twitter X, and Facebook. I don't think we have Instagram. And I know that most of you belong to one or more academic professional network, distribution lists, social groups. So by pushing out the posting on the platform, you can amplify the message and increase the likelihood that a connection will be made. Right. So I'm not, a big social, I don't have a big social media presence, but I do a lot of work on WhatsApp. So next slide, Andrew. So for example, on the right-hand side of a post, you can see, WhatsApp, LinkedIn, email, right there. And so I'm just giving you an example for, say I have a post, I'm like, so back to the slide, I said, oh, this one would be great for my colleague in Lesotho. I think that was the post. And so you click on WhatsApp. That's the post, and then you click on WhatsApp and you get this. So it works best if you can be on WhatsApp web, or if you're on your phone, I think that will be fine. And then it will take you to your WhatsApp account, and next click. And then you can send a message. That message will go to a colleague working in Lesotho. So that's kind of I think that was 4 clicks for me, and it's just the potential for connections and just strengthen the capacity of healthcare health workforce capacity is amazing. So please do that. Even something that if you don't think that you could help directly, try to push the posting out to your network. Thank you. Andrew, you want to unmute?
Thank you. Yeah. Okay, we also have a suggested email that you can send out to your contacts. And let's post this in the chat. So you can just copy and paste this and send it along to folks. Edit the message as you see fit, but it just gives you an opportunity, just something that's kind of prepared, that makes it a little bit easier. But of course, as Tui mentioned, you can also send an email through those links on the right side as well through the site. All right, so now then let me pull this back up. And we're going to move in, well, move into the talk about the ambassador program here a little bit. All right, and I think Asmer, would you like to take it away?
100%. Hi again, everyone. My name is Asmer, and I will be talking a little bit about the ambassador program. Oh, next, please. That's weird. So who are the ambassadors? There was a little bit of text here, but I'm not sure where it went. Anyways, but who
Let me
are
just
the
reload
ambassadors?
this really quickly, Asmer.
Oh yeah, no worries.
Hold on a second.
I can keep talking while you reload.
Yeah, go ahead.
But yeah, so the ambassador program was kind of created to help website users create better posts, navigate the website better, leverage the website's use cases to fit their needs. And so the ambassador program essentially consists of, right now, it is, I believe, from 10 to 15 students. And We're all passionate about global health, and we're all passionate about helping people to create better postings and just generally use the website better. And we're all here to help. So if you want to connect with an ambassador, you can reach out to me. I have put my CUGH Capacity Strengthening Platform username in the chat. So yeah, feel free to connect with me, and I can connect you to one of our ambassadors, and they can essentially answer many of your questions. And ideally, we can all be ambassadors, and we can all help one another out and help each other and give each other advice on postings and whatnot. And actually, we have a couple ambassadors from the program here today. One of them is Medium. Medium, why don't you talk a little bit about who you are and what you're excited to do?
Yeah, so my name is Medium. I kind of mentioned this earlier, but I'm an undergrad student here at University of Illinois Chicago, majoring in neuroscience, and I'm minoring in public health. Kind of like Osmer said, me and like everyone else who's doing this program is very passionate about global health. I think that as an aspiring physician, someone who wants to be a physician, I think having that sort of perspective on global health is very important. And yeah, I'm really excited to kind of see, as someone who's passionate about public health and global health, I like seeing like different gaps in healthcare and how we can help. And so I'm excited to kind of like help out with this program, but also kind of like learn more about the different gaps that exist here and abroad in other countries. And seeing how we can grow this program. I know I've kind of already talked to like Dr. Dykins about so how we can grow those programs like in the future, what we can add. We talked about like the language barrier and how like the plans that the program has to fix those in the future, things like that. So I'm really excited to be a part of this program and kind of see how we can grow it more. Yeah.
Thank you so much, Mediam. Fatou, why don't you introduce yourself too? Fatou is another student here at the University of Illinois Chicago who is also part of the Ambassadors Program.
My name is Fatou. Like Asmer said, I'm also an undergraduate student at UIC. I'm also a chemistry and French major on the pre-med track, interested in public and global health. And essentially a really big thing for me is that like I'm from Senegal and I spent some time growing up there. So I've kind of seen a bit of like the health disparities there are like both in the US, but also in different countries. So, having, a platform like this I feel like it's really important. And being an ambassador, I just want to help, help people have access to this type of platform from all over the world so we can all get the help that we need. Yeah.
Yeah, thank you so much, Fatou. I think it's pretty clear that, all the ambassadors are super excited to help out. So, again, if you do want to be put in contact with an ambassador and you need help creating a posting, or generally you have a question about the website, we're happy to help. I've put my CUGH username in the chat if you scroll up a little bit. But yeah, connect with me and I'm happy to help you out. Thank you.
All right, thank you all so much. I would encourage you to work closely with the ambassadors. If we think if you'd like to have a little bit of assistance with your posting, then please let us know. If we think also that we can help refine your posting or connect you with others, we may reach out to you directly as well. And the idea is just to help people engage with the platform in as efficient way as possible. So again, jump in, don't be afraid to make mistakes, and hopefully there will be lots of opportunity to connect with many, many people. All right, so I'll turn my camera on. All right. Now we'd like to move into a section where we'll be talking a little bit about some principles around capacity building, recruiting, training, and supporting workforce capacity institutional partnerships. Tweet, take it away.
All right. Thank you. I think we are quite ahead of schedule, so we probably will have time for folks to ask more questions about the platform. So this is a little bit different than the presentation we have so far. I thought that we would take this opportunity to kind of brainstorm a little bit about health workforce capacity challenges and best practices. Next slide, please. Okay. So I think Elsie alluded to it early on, but one thing that we don't always think of when we think of health workforce capacity is that there need to be attention to health equity and vulnerable populations. So next slide. So we like to subcategorize health workforce capacity building into training capacity, which is, you can think of it as pre-service education and continuing professional development. Maybe we'll go back because we'll show that later. Thank you. So as I mentioned, training capacity or pre-service education and then continuing professional development. So thinking about challenges to training capacity, what comes to mind? As we are focusing on health workforce capacity in low middle income countries, for those who live, study, work in an LMIC setting, what do you observe at your institution or organization? Or if you're a partner from a high income countries, what do you observe in the host country in your partnership? So health workers here can be defined broadly. So not only includes nurses, midwives, doctors, but also, pharmacists, dentists, lab technician, radiology technicians, physiotherapists, and so on. There's actually people have also advocated to include supply chain personnel, social workers, community health workers in what we think of as healthcare workforce. So maybe if you can put your thoughts in the chat. Does everybody have access to the chat? Or should they use the Q&A? You can do both, I think. Anything at all. Put down your thoughts on what are some of the challenges and barriers to training capacity. And we are focusing on LMIC. So if you are from high-income countries, think about your host countries, your partners. Okay. Audience participation is really important here. We'd love to hear from you. So the reason that we're putting together a little bit of this brainstorming session is we are preparing a survey that will be distributed to through CUGH on healthcare workforce capacity challenges and best practices. So funding, financial challenges, expensive training program abroad. Okay. No, those are all important. So I think the key thing that we all think about in terms of training capacity is funding. Lack of trainer locally. Exactly. Well, thank you for your input. Click, please. So I think you have all mentioned already some of these. We put down some thoughts like lack of faculty and instructors. Also, the quality of the teaching and training may not be optimal. We thought about inadequate compensation for current staff, lack of career development or advancement. Administrative support is actually very important, and sometimes that's really overlooked. And of course, there's the physical infrastructure and the material resources, whether it's library, supply, and so on. Thank you. Next slide. So what do you think are the challenges for continuing professional development? So CPD, as it's often referred to, refers to ongoing education and competency development by healthcare professionals beyond their initial training. So the purpose is to update and advance their knowledge, skills, and professional proficiency. CPD is different than training in that it is learner-driven. It allows learning to be tailored to individual needs. So in many LLMICs, CPD is not mandated, and uptake and participation by healthcare professionals are limited due to access barriers. So established CPD system might be lacking due to funding, infrastructure, and resource challenges. So put in the chat or the Q&A, what are your thoughts on the challenges for CPD? Oh, I like that. Not enough like time. Yes, that's when lack of opportunities. Wi-Fi requirement for these online, even when they're free, is sometimes can be prohibitive. Technology devices, financial. Okay. Yep. Thank you. We are thinking along the same way. Lack of follow-up routinely. Okay. Could you elaborate on that? I know you're not able to speak. Oh, actually, it's Josephine, so you can elaborate on that. Do you want to unmute and Josephine? Okay.
Yes, please.
It's lack of network, meaning lack of internet connection. Go ahead, Josephine.
I meant lack of supervision or direct follow-up, routine follow-up. This has to be done continuously. So this follow-up cannot done routinely. So this to update the accreditation, so there is no direct supervision and follow-up of this training.
I apologize. We heard just a little piece of that. Lack of recognized professional organization. Lack of motivation. I'm a very root cause of a person. So when I see someone say lack of motivation, then I ask the next questions. What is responsible for that lack of motivation, right? What's the underlying root cause? Lack of direct supervision. I like that. Work overload. Yeah, so that's explained to the time, and maybe that contributes to the motivation as well. Limited and non-availability of mentors. Does that play directly into challenges for continuing professional development versus training in general? Yeah, it could be lack of motivation caused by lack of funds, right? You have to prioritize your needs and what you need to do to take care of yourself and your workplace. So I get that. Thank you so much for sharing. Go ahead and click on to show us. These are some of, we kind of thought the same thing too, just to summarize what you have put in. So digital resources is big. I mean, a lot of CME or CPD in the US is online. And so if you don't have good access and actually most, I mean, some are free, but you have to pay for many of these CPD programs. Yeah, I think we alluded to supervision and mentorship. So I think that's really that's important. The financial piece we touched on already. Post-training follow-up, maybe that's why that's what Josephine is alluding to, right? And we talked about Wi-Fi and broadband access already. And I see here more motivation because people do not see the mission. Yeah, that could be related. But then why are people not seeing the mission, right? Is that some of that is what is leadership, is management, whatnot, right? Lack of direction, being specific instead of investigating to find out the major areas of need. Yeah. Yeah, sometimes the CPD is geared toward the understanding of the needs that folks from high income countries think that this is what we have CPD for, but it's not the priorities of the real needs of LMIC organization or institution. Poor publicity. I like that. Yeah, we haven't thought of that. Yeah, so how are CPD programs advertised, right? Do they use social media? Is everybody on social media? Is it only advertised through, kind of big NGOs or through government, and it doesn't always reach everyone? So I like that. Thank you. Next question. Okay, so we kind of put together, if you put these elements together, and then you add to it health systems, human resources management, and leadership, and then you have capacity building, right? So what do you see as challenges in health workforce capacity building in LMIC? So think of this now as broadly, not just training, not just continuing professional development, mentorship, supervision, but think broader. What are the challenges in health workforce capacity building? Think of health systems, think of governments, think of, training institution as a whole. Go ahead, put your thoughts into chat. Not sure where to start. I guess it's there's a I understand that sentiment. I think try to prioritize in terms of what you see as some of the top challenges, place to work on. Of course, there's the list is very long. So medical tools, meaning equipment, supply, yeah. And insufficient or sufficient remuneration is a big part of it, right? So, I mean, people have talked about retention of healthcare workers, which depends not just on training and continuing professional development, but the creation of the supportive environments that enhance service delivery, work culture, and systems to improve population health outcomes. So improving the health delivery landscape in regions such as sub-Saharan Africa is essential to retain the health workforce and to reduce migration. So sure we have work overload, but yeah, limited time. I have met, over the years, have had the privilege of meeting incredible colleagues and partners in various countries in sub-Saharan Africa, and they are one of the most hardworking people I know. And it just it's not sustainable, right? So we need to help our colleagues there in terms of support them in a variety of ways. Value women's time, so not always expected to volunteer or low pay. I think that is the gender disparities is really, we talk about that in the US as well, how a lot of caregiving are done by women. And a lot of these informal caregiving are not being supported or compensated in any way. So high patient to staff ratio, that's definitely and contributing to burnout and the poor work environment. Yep. Yep. Right. So policy development is required to promote retention, provide technology to optimize service delivery, improve work packages, and so there's a lot of system change that also is needed as well, right? So go ahead and click on to see what we came up with, a few things. So we talk about migration, right? Both migrating out of the country as well as some internal migration, because many universities from high income countries and international NGO will recruit staff and pay them so much better than the public sector could pay. So we see that. We talk a lot about these incentives that's not there, and that's related to management and leadership. And I think people also talk about national capacity building strategy. And we have touched on things like equipment and supply. Another thing is also, I think, the whole licensing, accreditation, and regulation. All of those take a lot of administrative work, a lot of effort system to put in, and that's not always easy for schools and facilities in low resource setting. And we also, we didn't touch on it yet, but this urban-rural divide, it's everywhere in high-income countries and low-income countries. But I think we really need different strategies and policies to support health workers working in rural and remote areas. So, and then last question. Next slide, please. Thank you so much, everyone, for contributing so far. This is really wonderful for us to help us refine the survey that will go out. So, I am a strong believer that, universities and partners from high-income countries could do more to support health workforce capacity strengthening in LMIC. Do you have some idea for us? I don't mean to say us as speaking for other members of the panelists, but for those of us who are part of programs and universities and organizations from high-income countries. What should we be doing more to support health workforce capacity strengthening in LMICs? Let's see. Provide financial assistance to enable them to study. Yes, yes. It is sad and a failure on my part. I have a partnership with the College of Medicine for years and years, and this is the next year is the first time that we're able to bring a student over for an elective. And so many of us have been over, working in Malawi, doing rotations and things. Availability of internship and programs. Yeah, we have so many of these internships and fellowships, and I'm not talking about in healthcare. It could be in training in other, nursing, public health, and so on. And it's often not available to trainees outside the country and so on. Elsie, I would love to hear your take on what is equitable partnerships. I know you touched on it at the beginning of our workshop, but I'd love to hear more on that as well. Exchange programs.
Thank you. I believe that there are opportunities that could be shared but making sure that whatever is shared is based, as I said earlier, on the needs of the low middle income countries. And when, like, for example, we have grants that whatever funding is available is distributed fairly, and that if there are opportunities for publications, still we make sure that it is done in a fair manner, and that knowing that many times the partners in the South actually may be less privileged, taking that into account in terms of even what the partners in the South may be able to offer. So all those things should be taken into account when we have these partnerships. Thank you.
No, I appreciate you kind of voicing that again, and for all of us to kind of take to heart. Even when you're not directly involved in the grant or research, advocating for policy change, for including more of our partners, I think is really important. So I love, is it Saskia? I love your comments. So yes, one of the way is to connect on the CUGH Capacity Strengthening Platform. That's one way that we could be a better partner as well. Get more students involved in research, collaborate with body that lead to different, I mean, that is an interesting thought. So, a lot of the professional organizations, right, whether it's physician, nurses, pharmacists, whatnot, tend to be very focused on just that country, where they are in, and not really reaching out beyond their borders, right, to invite colleagues from, especially from LMIC. So, anything else I missed? Exchange program. Yeah, I definitely think we need more and more of that. So great. Go ahead and show our participant what some thoughts we have, and I believe that should be the last slide for me. So provide scholarships, right? And we talk about provide CPD that is really the right context and addressing the needs of the local providers. Yeah, we thought of things like when you have a partnership, to support those key personnel, particularly in the public sector, right? Or faculty in the health professional school, your partner in this. And people even put out things like help with supply chain and lab and radiology equipment and personnel, because you want to create the healthcare infrastructure that would be, a good environment for healthcare workers to thrive, to stay, and also the importance of supporting research infrastructures. Although I think a lot of times the two of them go together, research and clinical. We were focusing on really clinical capacity more than research, but I know that a lot of time they do go together. So is there some more comments here? Oh, there's a lot more.
Maybe,
sorry.
I would like to say something that much as we expect our the universities and partners from high-income countries to support us, I think we should also realize that there's a lot also that we can utilize more efficiently from the low and middle-income countries. Partnering together, South to South partnerships should also be encouraged, as we said that training locally. We have expertise within our region that we may not be using, and always looking to the north when there's even some expertise within us. So even the low middle income country universities and partners should also look at ourselves and see what can we bring on the table, and then bring our partners for support. Thank you.
No, that is a wonderful point. And I apologize if I didn't mean for it to be just high income to, partnering with low income countries or middle income and whatnot. So I think the partnership can go every which way. And I think all of it have something to offer. And I love, I think Sandy mentioned about the ECHO programs. And, it started, at least I know with ECHO in the US, like more for like urban, rural, but I know it has expanded to global partnership as well. I think there's one in Uganda. And so, yeah, that type of program is really critical, important. Yep. Thank you. All right. Thank you so much. Andrew, turn it back over to you.
All right. Thank you so much. That was a very engaging discussion. Thank you all for participating in that. All right. So let's move back over here. All right. Okay. So I took the opportunity during that conversation to engage with many of you on the platform, and tried to connect with several of you. Thank you so much. We've got a really terrific response, lots of people signing up, and lots of great questions. So I'll speak to that in just a second. And we'll have some opportunities to also have some time here to continue to work through some things. I wanted to just show you also very quickly, this is actually a couple months old, so it's expanded since then. But we have a really nice representation already on the platform, especially in the Africa region, primarily because of AfriHealth, our close collaboration with AfriHealth. We have been able to engage a lot of people across the continent of Africa. And we are very excited to welcome many of you from various places, and hoping to build this list with robust engagement globally. So just an illustration of how unique an opportunity this is to connect with people literally around the world at your fingertips in an area of work that we're all very passionate about and engaged in ways that you might connect with someone at a conference. Now you can do that really at any time. So why don't you go ahead and join and connect if you haven't already, and we'll take a few moments to kind of work through some things. While you're doing that, I'll go ahead and tell you a little bit about how we're keeping the platform current. As I mentioned to you briefly earlier, all posts are live for 1 year from the time of posting. And there will be prompts to you as a user if you've created a post to update your post as you approach that year timeline. Otherwise, it will be automatically archived. And so please keep a note of that so that you can keep your posts live if you would like for them to be. And you can always find your archived posts in your profile section under My Posts, where you can edit them, update them, repost them, or delete them if you so choose. All right, so thank you all so much. I want to remind you that there will be 3 awarded registrations, free registration for the CUGH annual conference in March of 2024. That will be announced in early January. In order to be eligible for that, you will need to sign up, create a post, and create a match. So that is entirely feasible. Please get on and engage with others and see if you can create some matches. make some connections. And we'll look forward to seeing you at the CUGH conference. Okay, so let's get back to the Q&A for a bit and see what other questions we might be able to address. And in my engagement with folks in the last few minutes as well, there's some other things that I can share with you. So is there any other questions, open questions relative to engagement with the platform currently on our Q&A? It doesn't appear. Looks like this is all per the prior conversation. Anything in the chat? I know we had a really rich discussion just now.
May I say something, Andrew?
Please.
And maybe we can get input from our audience as well. I
Yes.
think one of the challenge I have is getting the right people with training and with the resource who is maybe in a position to be a mentor and so on, to get them engaged. They might not be haven't worked in global health setting that much, so they may have focused on their own thing, and so some thoughts and strategies and how to motivate those folks to really sign up on the platform. Because we have, for example, here in Pittsburgh, we have a huge implementation science group with offering a lot of training, and I've been asking them to kind of please sign on to this, and I think they are not used to working in a global kind of context, and so hesitant to haven't done that. So that's one of your thoughts on that.
Thank you, Twee. So if anybody has a response to that, please do so in the chat. I'd like to also just go back to the platform itself. And let's take another look around if anybody has any questions. Okay, here we go. All right, so there we go. So in engaging some of you, I wanted to mention, so many of us have multiple areas of interest, multiple areas in which we are working. Please feel free to create multiple posts. If you have multiple areas that you'd like to be mentored in, or various things that you're hoping to develop partnerships for, you're more than welcome to create multiple posts. And so we absolutely encourage you to do that, as opposed to lumping several areas of focus into a single post. Go ahead and create separate posts for those things, whatever applies best to you. And you're welcome very much to do that. Wanted to remind everybody that on your profile page, you can find various pieces that can help you navigate your communication. Your additional profile information is listed here, where you edit your profile. You can send status updates to audience at large or individual members here. Find your connections here. Many of you are seeing your names as we've recently connected. Upload documents for others to be aware of and to share through your mentoring postings. This is where your postings are listed, where your current matches are listed here. This is a new, as we mentioned, functionality. And so we're excited to see this built out. And your Sage postings, ones that you've engaged with that you want to keep track of. All right. Does anybody have any additional questions? Anybody like to work through anything? Be more than happy to spend some time working with you on a post. If you have questions about how to engage with the platform, you're welcome to ask at this time. So I'll stick around. If anybody wants to ask some questions, I'll stick around for a few minutes or a while, as long as people would like to engage. Otherwise, I want to thank our panel for your participation, for sharing with us today. Thank you as an audience for joining us. We really appreciate your being here. Thank you so much for engaging with us on the platform and helping us to disseminate this platform to others as well. In the coming days, please take a look, create posts. Again, don't be afraid to make mistakes. We're here to help. And we can work through some things and hopefully find opportunities to connect. Elsie, would you like to invite the group to join you in your webinar tomorrow?
Yes, thank you, Andrew, for the opportunity. Tomorrow, AfriHealth will be hosting a webinar on challenges and solutions to the climate change crisis in Africa. It will be at 9 a.m. EDT, and it is going to be interesting. We would like to interact with you and hear your views and hear about what the work that you are doing. You'll also be able to, we have great panelists that are doing some work in this area. So please join us. You are all welcome. Thank you very much for the opportunity, Andrew.
Absolutely. Thank you, Elsie. That's a very exciting webinar, and we'll look forward to it. And we have someone raising their hand. I'm not sure how to respond to that. You might need to, oh, so maybe the question was how to register for that. I think, Elsie, would you like to address that?
Oh, I don't have the link right here with me, but if you go to CUGH.org and get into the Global Health Week registration, you'll be able to find it.
Let me try to find it.
Oh, thank you.
And put it in the chat, okay? Give me just a minute. Sorry. Let me find that session. So oh, sorry. It's harder than I thought. Sorry about that. Okay, I think I found it now. So that's the one Thursday morning. Oh, right here. Okay, so.
I think I've got something also.
Okay, hang on. I didn't realize it take me to a different website. Okay.
I think I got
here.
it.
Registration. Yep. Okay. We'll probably end up finding it at the same time. Yay.
Thank you.
You did it. Yep. Yeah, I think this is the same one. Perfect.
Very good. Thank you all so much for joining. And we'll see you on the platform.